What is depression? Depression is a serious but common mood disorder. It causes severe symptoms that affect how a person feels, thinks, and handles daily activities. Depression must be present for at least 2 weeks. Several types of depression develop due to particular circumstances. Depression that begins during pregnancy is called prenatal depression, and depression that begins after the birth is called postpartum depression. It is depression that comes and goes with the seasons, with symptoms typically starting in late fall and early winter and dissipating during the spring and summer months. Depression with psychosis symptomatology is a severe form of depression in which a person experiences psychosis symptoms such as delusions, disturbing false beliefs, or hallucinations, hearing or seeing things that others don't hear or see. It can last for several months or longer. The symptoms of a persistent depressive disorder include depression that lasts for at least 1.5 years and a loss of interest in life. Symptoms are similar to those of a major depression. In addition, bipolar disorder also causes manic or less severe hypomanic episodes or unusually elevated moods. General signs and symptoms. What symptoms occur and how long they last can vary depending on the severity. The symptoms of depression can be experienced differently among females and adolescents. If you experience some of the following signs and symptoms for at least 2 weeks, you may be suffering from depression. Men may experience symptoms related to their mood, such as anger, aggression, irritability, anxiousness, or emotional well-being, such as feeling empty, sad, or tired easily, thoughts of suicide or drinking. Females may experience similar symptoms, such as irritableness, anger, or rapid changes in mood. Rapid shifts in mood or changing emotions are such as angry, irritable, or sad. Changes in appetite, decreased energy, and other physical well-being issues. There are changes in appetite, pain, headaches, and cramps. Weight changes such as cramps or increased appetite. Symptoms and patterns. A depressive episode is different from a regular mood swing. They last most of the day, almost every day, for at least 2 weeks. They may feel a loss of interest in activities of pleasure. Depression can cause difficulties in all aspects of life, including in the community and at home. According to the number and severity of symptoms and the impact on the individual's functioning, a depressive episode can be classified as mild, moderate, or severe. There are different patterns of depression, including single episode depression, meaning the person experienced only one recurrent episode of depression, and also other types of depression such as manic depression, and other symptoms such as increased activity or energy. What causes depression? An imbalance of neurotransmitters, including dopamine and serotonin, contributes to depression. Life events such as the death of a loved one, trauma, divorce, and lack of support can cause depression. Some medicine may cause depression as a side effect. The use of alcohol and drugs can also cause depression. Is depression genetic? There is no family history of depression for many people with depression. According to a recent study, susceptibility to depression may not result from genetic variations. While people can inherit depression, many other issues also influence its development. How is depression treated? Depression is usually treated with medication and psychotherapy or a combination of the two. Some people may experience treatment-resistant depression, which occurs when a person does not get better after taking at least 2 antidepressants. If medical treatment and psychotherapy do not reduce depressive symptoms or the need for urgent relief from symptoms, brain stimulation may be an option. Depression affects no two people, and there is no one-size-fits-all treatment. Choosing the best treatment can take trial and error. Management. A normal, temporary response to life events, such as a symptom of a medical condition or a side effect of some drug, can occur. A prolonged depressed mood, especially in combination with other symptoms, may lead to a diagnosis of a psychiatric or medical condition which may need treatment. Physiological activity has a protective effect against depression in some people. According to some studies, yoga may help people with depression, but more research is needed. It is another alternative treatment, especially for the elderly who have lived longer and have more experiences in their life. It is a method that causes a person to recollect memories of his or her own life, leading to a process of self-recognition and identification of familiar stimuli. There is limited evidence that continued use of an antidepressant medication for 1 year reduces the risk of recurrent depression with no additional harm to the individual. Psychological treatments or combination therapies in preventing recurrence are not clearly recommended. There is not clear evidence that psychological treatment or combination therapies can prevent recurrent depression in the long term. Depression with psychosis. People are affected by depressive psychosis when they see, hear, or smell things that are not real. However, it's not clear what causes these two conditions or why they can occur together, but treatment can effectively ease the symptoms. Knowledge of the risk factors and possible causes can help you to be aware of early symptoms. Both conditions are particularly dangerous when combined. Depression can cause someone to have thoughts of suicide or take unusual risks. Depression is a major depressive disorder with psychotic features. Life events, adversity in childhood such as bereavement, neglect, mental abuse, physical abuse, and sexual abuse can contribute to depression in adulthood. Childhood physical or sexual abuse significantly correlates with the likelihood of experiencing depression over the survivor's lifetime. Life events and changes that may cause a depressed mood include, but are not limited to, childbirth, menopause, financial difficulties, and stress from work and education, family living conditions and bullying, loss of a loved one, natural disasters, and social isolation and relationship problems. Following social rejection or peer pressure, adolescents may be particularly susceptible to experiencing a depressive mood. When should I see my healthcare provider about depression? A common depressive condition affects millions of people a year. Anyone can experience depression even if there's no reason for it to happen. It's better to get help sooner. If you start treatment for depression and it doesn't work, or you have unpleasant side effects, talk with your doctor. They can suggest a different treatment plan. The clinic notes that depression is treatable and that the sooner you get help, the better you feel. Diagnosis. A qualified health professional can rule out different causes and provide an accurate diagnosis and provide safe and effective treatment. They will ask about symptoms. Also, a doctor may conduct an examination to check for physical causes and order a blood test to rule out other health problems. Brain stimulation therapies. Different types of brain stimulation therapies exist, and other brain stimulation therapies are still being investigated for treating mental disorders like depression. The electricity is given directly through electrodes implanted in the brain or indirectly through electrodes on the scalp. The other therapies are newer and still considered experimental in some cases. These therapies are used only for most mental disorders after medication and psychotherapy have been tried, and usually continue to be used along with these treatments. Vagus nerve stimulation is usually a surgical procedure that involves implanting a device under the skin to activate the vagus nerve. Ask your healthcare provider and make sure you understand the potential benefits and risks of brain stimulating therapy before undergoing it. Changes in the brain. Most modern antidepressants have an effect on the brain's chemical transmitters, in particular serotonin and norepinephrine, which relay messages between brain cells and the brain. It is believed that this is how medications work for depression. If severe depression has not been recovered with lifestyle change, psychological therapy or medication Other medical treatments, such as transcranial magnetic stimulation and electroconvulsive therapy, may be recommended. Some factors that can lead to faulty mood regulation in the brain include genetics, lifestyle factors, and taking some medications and alcohol. Is it curable? Others will have relapses. To prevent relapse, people taking depressive medication should continue with the treatment even after the symptoms improve or go away for as long as the doctor advises. The sooner the treatment starts, the more successful it may be. Exercise. Aerobic activity raises endorphin levels and stimulates neurotransmitters. The greatest benefits of exercise come when combined with standard treatments such as antidepressants and psychotherapy. It is said that exercise can be particularly helpful for treatment-resistant depression. In females, researchers found that females were more likely than men to report depression symptoms and seek treatment. In males, as a result of depression, men are more likely to drink alcohol in excess and display anger and risk-taking. Does depression affect your thinking? Depression can affect concentration and decision-making skills. It may also impair attention and cause problems with memory and information processing. What are the risk factors for depression? Depression can occur at any age, but often begins in adulthood. Other risk factors for depression include family history of depression or personal history of depression. Major negative changes in life, such as trauma or stress, can also contribute to depression. Thank you for watching. Do subscribe, like, and share.